Hi, everyone. On this cold, snowy day in Kansas, I'm Susan Osborne, and I'm welcoming you to the Women for Kansas Education Foundation Call to Action for Expansion event with Governor Kelly. First, let me give you a brief explanation of Women for Kansas and the Education Foundation. We're a grassroots initiative that energizes and educates individuals and groups of women and men across Kansas about moderate policies. We have 11 chapters all over Kansas. They're all joining us today, and I'd especially like to note that we have two chapters, Winfield and Lawrence, who've gathered their communities together for meetings in large meeting rooms. We have over 20,000 followers. Our Education Foundation engages in nonpartisan educational activities on behalf of our shared values. This year, Medicaid expansion is our top priority. For more information, go to women4kansas.org. Secondly, let me briefly explain why Medicaid expansion is so important this year. Expanding Medicaid will provide access to health care to low-income Kansans. 150,000 Kansans are in what is called the gap, which means they earn too much money to qualify for Medicaid and yet earn too little to access an affordable health care plan. Let me give you an example. A single mom who earns $790 a month makes too much money for Medicaid, and she's caught in a gap and certainly can't afford to pay for health care insurance. 40 states have already expanded since states started signing up 10 years ago, including all the states that surround Kansas. And the vast majority of Kansans, between 70 and 80%, support expansion. We Kansans have paid in over $7 billion into expansion with our tax dollars that have gone to other states who've expanded, not to us Kansans. Expansion is cost-effective. No state that's expanded has canceled, and research points to increased survival of rural hospitals and communities in those states. Kansas has the highest rate of closure risk for rural hospitals. The current structure in Kansas actually acts as a deterrent for low-income Kansans to get a better paying job, because then they would be caught in the gap. Now, I know you'll want to ask questions, so please submit your questions into the Q&A at the bottom of your screen. Now, almost 1 year ago, Governor Kelly began her second term as the 48th governor of Kansas. In her first term, she worked with both parties to balance the budget, fully fund schools, repair the state's infrastructure, reform the child welfare system, and break records for business investment and job creation. Governor Kelly believes in the importance of service and integrity and accountability. In her second term, Governor Kelly intends to make Kansas the best state to raise a family, and she has prioritized early childhood development, spreading prosperity throughout Kansas, and to expanding affordable health care to low-income Kansans. Today, we focus on Medicaid expansion. Please join me in welcoming Governor Kelly.
Well, thank you, Susan. I appreciate the introduction. And I also appreciate Women for Kansas. You know, I was involved with Women for Kansas when it was first started. I don't remember how many years ago that was, but went to the convention in Wichita and really met some outstanding people and have stayed engaged, even as a candidate for governor. So, and I really appreciate Women for Kansas taking on Medicaid expansion as a high priority for this legislative session. You know, your group is incredibly effective and has voices that are listened to. So thank you. Thank you for throwing your support behind these efforts. You know, we have now tried to get a bill passed to expand Medicaid 5 times since I've been governor. Each time we put a bill together and present it to the legislature, we tailored it to respond to the objections that we heard from people who opposed Medicaid expansion. Every time we'd come up with a new proposal addressing some of their concerns, they would just move the goalposts. I mean, the point was never to get to a point where we would agree. They were just never going to agree that Medicaid expansion is something that we ought to do here. And when I say they, I'm really talking about legislative leadership. The rank and file legislators actually passed Medicaid expansion in 2017. Then Governor Brownback vetoed it, and we were not able to override his veto. When I became governor in 2019, I believe the House of Representatives passed Medicaid expansion. It got blocked from discussion in the Senate, and that's the way it's remained since. That while there's interest on the part of the rank and file legislators, legislative leadership in both the House and in the Senate have prevented any debate and certainly any vote on Medicaid expansion. So that brings us to this year. This year, my usual style of getting things done is to bring people together, discuss the issues, try to build consensus, and then come up with some bipartisan approach to the issue. I've tried that 5 times. This time I'm taking a little bit different tact. While I'm still interested in the bipartisan part, we really have taken on a more political approach because it's become strictly a political issue. There is no good policy reason or any good budgetary reason to not expand Medicaid in the state. Other states, for as long as 10 years, have had Medicaid expansion. And it is working. We have learned a lot from the experience of other states. We built that into the proposal that we'll be putting forth. So it takes care of all of the issues that we've heard. They want to say that this will only take care of able-bodied people who are too lazy and just don't want to work. That's not true. We know that I think it's 75% of the people in the gap are actually working. They're not sitting at home. They are working, but they're working in jobs like fast food restaurants, nursing homes, daycares, where there is no employer-provided insurance. So they're not covered. But it's not because they're not working. The ones who are not working and fall into that gap are oftentimes taking care of an elderly parent, a young child, or they may have some mental health issues that preclude their entering the workforce. So there are very few people, there's probably a few people who would scam the system. That'll always happen. But the vast majority are folks who are working or have legitimate reasons for not working. So that argument's out the door. But we heard them, and so we have put into the proposal this year a work requirement. We're taking a different approach than other states have taken to that because other states have had it ruled not allowable under CMS standards. We're taking an approach that we think CMS will approve, and that is, and I won't go into the details of that, but we think we've covered that one. So we really built this whole thing so that the work requirement is there that they said they wanted. We've made it cost neutral. We put provisions in that bill that will ensure that Kansas taxpayers don't have to pay another cent for Medicaid expansion. It is paid for in the bill that we'll present. So they really can't come up with any good budgetary policy reason to not pass Medicaid expansion. So what we need to do is we need to put pressure on those rank and file legislators who want to vote for Medicaid expansion. We need to put pressure on them to then exert pressure on their leadership and give them the opportunity to debate and vote for Medicaid expansion this legislative session. The fact that 2024 is an election year and every legislator will be on the ballot will by itself put a fair amount of pressure on these people. So if they are then hearing from constituents that this is really a big issue, we really want you to do this, that will help them and give them the cover they need to pressure legislative leadership to give them the opportunity to debate and vote for Medicaid expansion. So we're going to need folks like you to write letters to legislators, particularly the health committees in both the House and the Senate, and let them know how important this issue is and how you expect them to give their committees an opportunity to discuss Medicaid expansion and to send it to the floor for full vote. We need you to work with folks in your communities to get them to do the same thing, rally their support, and have them talking with their legislators, really encouraging, pressuring their legislators to get this thing to the floor for a vote. So very much appreciate what all of you are going to do. I think April's going to be doing some, sort of coaching and teaching training on how to execute the advocacy plan that we need in order to really put the pressure on folks here to get this to debate and vote. So with that, I'm glad to take any questions that people might have.
I think Brianna Johnson, your Director of Communications, has got some questions that are from the audience.
Yep. Hi, Governor. So I know folks are putting in questions in the chats. Thanks so much. I'm getting those. I'll start with you mentioned that we've tried 5 times before. What makes you believe this 6th time is different? What is different about why we can get this across the finish line?
Well, I think I've mentioned it, we're taking a very, very different tact to getting Medicaid expanded. We're moving away from the collaborative consensus building, where we have actually been going all over the state this summer and fall, meeting with a whole host of different sectors. The healthcare sector, obviously, but business sector, whether you're talking about aviation, hospitality, childcare, we have gone into every business sector and working to garner support and pressure from all of those. I think, and we've been educating people. What we found is that so many people really didn't understand what Medicaid was and therefore didn't think about it very much. Once they really understood what it was and the impact that it would have on Kansas, and not just for the 150,000 people who would get covered, but what it would do to protect our rural hospitals, what it would do to create jobs, what it would do to help us retain our healthcare workers in our state and not have them go to one of the surrounding states where Medicaid has been expanded. Once we've gotten that word out, they've gotten really enthusiastic. And I think along with the 200 or so people we've got on this call, hoping that all of that really grassroots support will define itself by getting the debate and the vote on Medicaid expansion. But should that not happen, the other thing that we have laid the groundwork for is, with all the work that we've done, if we don't get Medicaid expanded this year, then we get to go into the elections in August and in November. And we have laid the groundwork where Medicaid expansion will become the #1 issue in the state legislative races for next year. And we hope at that point, then, if we need to, we will work to replace some of the legislators who have not been willing to support Medicaid expansion with legislators who would.
So a lot of the questions in the chat are about the opposition to how to convince legislators that are still opposed. You mentioned that you think of, if this were to go to the floor today, the majority of legislators would support this. And so I was going to ask about, obviously you were a state legislator for a long time before becoming governor. So from your time in the state legislature, what do you think are the most effective ways to get legislators who are on the fence about expansion to ultimately vote for the bill? What are the most effective arguments that we can be making to them? What do they like hearing? What is the most convincing thing they can hear from constituents, including those on this call, about why they should support expansion?
Well, I won't be Pollyannish about this. I mean, the fact of the matter is this is an election year, and they know that. They all know that, and they're all up for election. And so I think legislators respond to when they get a lot of pressure from constituents who are in their districts. And they realize that, they can't do one thing in Topeka and then go back to their district and pretend, that they're really representing their constituents. I think that is what will open their eyes and really give them the wherewithal to go, in some ways, to defy leadership. I mean, it's tough. That part I know is tough. It is really hard if you've got a leader in your caucus who is so adamantly opposed, for you to form a coalition with your other legislative colleagues and put pressure on that leader to let you take a vote on something. I know it's hard to do. They need to be able to say to the leader, I'm getting calls, I'm getting letters. I've had so many people in my office, or I've so many people calling me at home. When over the weekends, when I'm not up here in Topeka, it's just that they just need to hear from people, and they need to hear that this is important, and that this is going to influence how people are going to vote come next August and next November.
Thanks. And one thing that some people are mentioning in their questions is that the Chamber of Commerce announced opposition to expansion. I don't think that was a surprise really to anybody, but I know that you've been talking and having conversations with businesses, one-on-one with business leaders who find the arguments for expansion really compelling. And I was wondering if you can share what are the arguments they found most compelling, and why you believe will be such a good thing for our overall economy, not just for the 150,000 Kansans.
Yeah, well, it depends upon the sector, what they found most compelling. I mean, for folks in, the hospitality, hoteliers, people, restaurant owners, folks over there, it clearly would directly impact a lot of their employees. A lot of their employees fall into this gap. A lot of employees in daycare centers, in nursing homes, fall into this gap, where they make more than $9,500 a year, but less than $25,000, and that is the gap. Now I'm talking about a single parent with 2 kids, $9,500 a year to $25,000. If they make something in that donut hole, they can't get insurance. So I think that's compelling for that sector, where a lot of their employees are likely to fall into that gap. We had a number of folks from the aviation industry, for instance, in one of our meetings. And when I was talking with aviation, bankers, realtors, for most of them, their employees have insurance, have employer-based insurance, but the people taking care of those employees' kids don't. And we know there's a huge childcare shortage, and we know that, lack of childcare is often the biggest cause for absenteeism. So, having your childcare providers eligible for Medicaid expansion really then helps those employees show up for work. So that's how, those manufacturing companies and the bankers and realtors, that's how they could see how they benefited. And it really was sort of an aha, this does matter to me. So, and I would like to address the Kansas Chamber, which did come out, yesterday, I think, opposing it. We actually met with the Kansas Chamber Board, and I was a little bit surprised that they made an announcement yesterday that they were going to continue to oppose Medicaid expansion. Interestingly, they did not oppose Medicaid expansion before I became governor. They were just neutral. They didn't deal with it. When I became governor, all of a sudden they started to oppose it. But after I met with them, I thought that we might see them at least go back to neutral, because there were a number of board members there who were clearly got the message, understood the importance of this. So I'm going to do a little checking and see how that all happened. But yeah, it's not unexpected, but disappointing because I think they really do. If you're going to represent your businesses and you're in business community underneath you wants Medicaid expansion, then you probably ought to be there with them. And quite honestly, a lot of the local chambers are, so Overland Park Chamber of Commerce, for instance, has been one of the biggest, most vocal supporters for Medicaid expansion for a number of years. We just had the City of Hayes, I think the city council there voted to do a resolution to support Medicaid expansion. Johnson County commissioners did that. Russell, Kansas, came out in support of Medicaid expansion. So we know that, underneath some of those, just like the leadership in the House and Senate, we think underneath there, we've got a bunch of people supporting Medicaid expansion. So the Chamber of Commerce has this, Kansas Chamber of Commerce has the same thing, that once you get past that leadership level and you get down into the grassroots across the state, that the local chambers and the local businesses are much more supportive.
Okay, I think we have time for about 2 more questions. So one thing that's coming up a lot, and I know that you've talked about this a lot, is how expansion would impact our rural hospitals. I think not everybody always understands that connection between Medicaid expansion and why that would benefit rural hospitals. And we've gotten that question a couple times in the chat, so wondering if you can address that.
Yeah, well, Medicaid expansion will benefit all hospitals in Kansas. Whether you're talking Ascension Via Christi in Wichita, or you're talking the hospital in Liberal. So it benefits everybody. It just has the most impact, though, on our rural hospitals, just because for one thing, they provide a lot of charity care because of the populations that they serve. If these folks, low-income folks who fall in that gap, had insurance when they come in the door, these hospitals in our rural communities would not have to be providing emergency room care and not get reimbursed. Or they wouldn't need to do mental health services and not be able to get reimbursed. So it's just a portion of their budget that would be impacted by this. In particular, a lot of our rural communities, you do have, particularly down southeast, you've got a number of folks who fall into that poverty range, but you also have a number of elderly, who also would be impacted by this expansion.
Okay, and I'll have one last question, which is, you mentioned that 40 other states have expanded, most recently North Carolina. And I was wondering what we've seen in those other states, how they got that across the finish line, and also what has gone well in those other states that make you believe that we can make sure this happens in Kansas as well this session.
Well, we do know from the states that have expanded, and beginning back in 2014 when we first could have done this, there were a lot of lessons learned. There were a lot of fears initially about what would happen if you were to expand Medicaid. And there was this whole concern that, people who are currently on their employer's insurance would drop out of the private insurance pool and come into the public insurance pool. That did not happen. No state has seen that happen. People aren't chomping at the bit to get on Medicaid. So if they've got employer-based insurance, they're keeping it. I think some of the other concerns was that it would break the bank, and no state has seen that. In fact, what they have seen is that it ends up saving them money in other ways. We know, for example, that if we get Medicaid expanded, that some of the medical bills that we are currently paying for people in our prisons, or your counties are paying for people in the jails, those bills could get picked up by Medicaid and obviously save the state a lot of money and save our counties a lot of money. So there are all sorts of ways, and that's another way that this impacts our rural communities, is because they don't have the budgets to deal with sometimes astronomical medical expenses that come out of folks that they're holding in their jails. So lots and lots of ways that this benefits our rural communities.
Okay. Thanks, Governor. Any closing words on why it's worthwhile for people to join this fight?
Well, it's good for everybody. We actually calling the bill that we're introducing this session, the cutting healthcare costs for all Kansans, and because that's exactly what this will do. It won't just for the rural hospitals. It will also mean that our businesses are paying less to cover their employees because all the states that have expanded Medicaid, while they still see an increase in the premiums for their employees, they're a whole lot less than the premium increases that states like Kansas and the other 9 that have not expanded Medicaid have experienced. So this really does go across the board, impacts everybody. It's good for everybody, doesn't hurt anybody. And there's absolutely no good reason to do it. We should have done it 5 years ago, but we have an opportunity to do it now. And with support from people like you watching this, I think we can get this done.
Okay, great. I'll hand it back over to Susan and also to the Alliance team. I know that there were some questions in the chat that were about how do I tell what way my legislators voted, and then also how to hold them accountable, what letters to write. And so I know that that'll be something the Alliance will answer. So thanks.
I'm going to let you get on to your meeting. Take care. Hello, April. Good to see you. Bye, Susan.
Thank you so much, Governor
You're
Kelly.
welcome.
Very helpful, very informative. I would like to now introduce April Holman, who is the Executive Director of the Alliance for a Healthy Kansas. So many of you have had action questions, and April's going to deal with those. Thank you.
Thank you. I really appreciate the opportunity. While my slides are being loaded, I just want to introduce myself and our organization. The Alliance for a Healthy Kansas is a nonpartisan organization that is really geared towards increasing access to affordable health care. And we've been working on the issue of Medicaid expansion for many years. So many of you have helped us along the way, and we're very grateful for that. We are not involved at the electoral level, but really at the advocacy level for Kansans across the state to engage in this movement and to really turn their advocacy to action this year, when I think that is so needed. So with that, I think we can start the slides. Or advance, please. Perfect. So before we talk about advocacy, I think it's really important for us to get back to grounding on what is the coverage gap. So what are we trying to address with expansion? And then talk about some of the things that you might want to share with policymakers as you're making your case for why expansion should happen in 2024. So what is the coverage gap? Basically, Governor Kelly and Susan have both talked about this. In Kansas, if you are an adult, the default is that you do not qualify for the Medicaid program. So the basic rule is adults do not qualify for Medicaid, regardless of how low income they are. There are a few exceptions that you're probably familiar with. If you are a person who has a disability that is acknowledged by the Social Security Administration, that is one exception. If you have a child under the age of 19 in your household, that is another exception. And then the third main exception is if you are a pregnant woman, then you also, there is a way for you to qualify for Medicaid for the duration of your pregnancy and the 12 months after that. But it's really important that you know that we have very, very low income adults who don't qualify for any of those exceptions and just are out of luck in Kansas in terms of having a way to access affordable health care. On the other side of that, the way that the Affordable Care Act was created, if you earn at least 100% of the federal poverty level, then you can qualify for subsidized health plans on the marketplace, which is healthcare.gov. And so there have been a lot of really important improvements throughout the pandemic, and even still bringing the cost of some of those plans down. In fact, there are even some zero premium plans that are available for people at the very lowest, who are the very closest to that 100% of federal poverty, which has been a wonderful thing that's happened in recent years. And those will be in place through 2025 under the current law. The thing is, if you don't earn at least 100% of the federal poverty line, you don't qualify for those. So all of the people who are either individual adults, single adults, or adults who don't meet one of those criteria, so all of them up to 100% of the federal poverty, and parents who earn more than 38% of the federal poverty line fall into this coverage gap. They don't have access to any assistance in getting healthcare coverage. So hopefully this little umbrella visual will help you kind of get an idea. On the red left side, we have a pretty scaled down Medicaid program. It helps some adults, but not all, and that's the exception rather than the rule. We have these marketplace subsidies that are really helping people, but you have to earn at least 100% of the federal poverty line. And everyone in the middle of that umbrella are the people that we are talking about with a coverage gap. You can advance the slide, please. And so what would Medicaid expansion do for the people in the middle who are in the coverage gap and their communities, the providers who are serving them now and are not being compensated for that care, and really for our state economy, is that expansion could reduce healthcare costs for everyone. If you don't incur the costs in the first place because you have insurance, then you are better off as an individual and your family unit, but also everyone else who gets care from that hospital or provider does not need to worry about their costs going up to cover the uncompensated care. It protects Kansans from medical debt. It supports a healthier workforce, keeps Kansas more economically competitive, preserves and strengthens rural communities, and ensures uniform access to affordable health care for all Kansans, regardless of where you're located in the state and what community you might come from. Can you go ahead and advance the slide, please? So we have a lot of resources that provide more detailed information about the coverage gap, how it works, what the benefits of expansion are, including fact sheets for every county in the state. Those are in the process of being updated this month. So if you log in today, you're going to get 2023 information, but hopefully by the end of January, we should have the 2024 information all up and in place. And if you use this QR code, you'll be able to get to those Kansas County fact sheets to get that additional information. Can you please advance the slide? Thank you. Also on our website, which is expandcancare.com, we have a briefing book. You'll see the visual for the 2023 briefing book. Again, that's being updated to 2024, and that will be available by the end of this month so that it's not going to change significantly. I encourage you to still go look at that book now before you start talking to policymakers. But just look for some additional information that will be coming in the 2024 edition. Can you please advance? Okay, so hopefully that was really quick, but hopefully I gave you a taste of why expansion is important and the problem that we're trying to fix, which really is about 150,000 people who would benefit from a Medicaid expansion and the access to affordable healthcare that it would bring. So what are our expectations for early this session? We know that there is a bill that is already ready that the governor has created We believe that that is going to be introduced, hopefully, within the first 2 weeks of the session. Some things can be a little bit out of our control or the governor's control. But I think that because it's already drafted and basically good to go, I think we can look for that here within the next 2 weeks. And then we expect and hope to have a bill hearing by the end of January. Just as background information, we have not had a hearing on Medicaid expansion legislation in the Kansas House of Representatives since 2017, and there has not been a bill hearing in the Kansas Senate since 2020. That is in spite of the fact that there has been a bill introduced every single year on expansion. So the democratic process and the legislative process has really been completely blocked when it comes to this issue, and that can't happen anymore. There are too many people who need to have that access to care and too many providers who need to have the compensation that will help them to be financially strong and viable going into the future. So you will be receiving action alerts from the Alliance and potentially from Women for Kansas and other organizations throughout the legislative session in regard to Medicaid expansion. And we hope that you will be able to respond to those action alerts and reach out to your policymakers or whatever that ask might be at the time. So please look for those. Make sure that we have you included in our network or Women for Kansas has you in theirs to make sure that you're getting those emails and you know when there's a crucial time during this process. Please advance the slide. So we wanted to give you some concrete ways to turn your advocacy into action when it comes to Medicaid expansion. The very first and most important thing is for you to know who your elected officials are and be in touch with them. So if you don't know who they are already, that's okay. There is a resource online called pluralpolicy.com. It's a nonpartisan site that will help you. If you put in your address, it will let you know who your elected officials are. And that's the very first step to being able to contact them. So again, pluralpolicy.com if you want to find out who your legislators are, if you don't know who they are already. Please advance. So the first thing that we're going to ask you to do once you find out who your legislators are is to reach out to them and let them know that expansion is important to you. Let them know why it's important in your community. Let them know if there are personal stories of somebody that you know, maybe a family member, maybe yourself, maybe someone you know from church or the community that has fallen into this gap, and talk about their need for coverage. So it's just really important, as the governor said earlier, for your elected officials to know that you care about this. There are some other things that you can do in addition to that, and you can do that in a lot of different ways. So you can email them, you can reach out to them by phone. Their phone information is available on the Kansas Legislature's website. You can talk to them when they're in your community doing, a lot of times there will be community meetings where they update their constituents on what's going on. In a lot of communities, that's through the Chamber of Commerce, but there are also other groups who will hold those meetings, and sometimes the legislators do it themselves. So it's a matter of finding out what's happening in your community. We try and put those events on our website as we know about them, but there are lots of ways, I think, in local papers and things that you can hear about that as well. Once you've been in touch with your legislator to let them know this is important to you, we have some group activities that are going to be happening throughout the legislative session that we wanted you to know about. So the first is called the Love Thy Neighbor Synchronized Sermons Weekend. We're going to have faith leaders who are doing sermons throughout the weekend of February the 3rd and 4th, talking about the importance of access to healthcare and particularly about Medicaid expansion. Can you advance the slide, please? That's going to culminate to Love Thy Neighbor Day at the State House, where there's going to be an open invitation for people of faith and other advocates for expansion to come to the State House and meet with policymakers to talk about the importance of expansion. That the 14th is not only Valentine's Day, but it's also Ash Wednesday this year. So a very important day from a lot of different angles, and an opportunity to be at the State House and share your support for expansion. Please advance the slide. On March 6th, we're going to have a rally for expansion at the Kansas State House. We're going to be bringing buses. Again, last year we brought a bus from the Wichita area that stopped in several central Kansas communities. We're going to try and expand out to the more western Kansas area with a second bus this year. So look for more information about that as we get closer to March, but circle March 6th on your calendar, and please plan to come to Topeka for the rally if you're able to. This is a way to really get the attention of policymakers that we mean business, and we have many in number. Many people in Kansas care about this. Please advance the slide. And then there's also going to be statewide bike rides coming to Topeka in April of 2024 as another way to gather people who are passionate about expansion and also to spread the word about this. Because as the governor said earlier, we've been working for years to try and educate people about expansion, but it's a complicated issue. And sometimes it means a conversation specifically with an individual. So this is another way for us to get the word out about this really, really important policy. Please advance the slide. You can also share your Storyteller, which we are always looking for people who will help put a human face on the coverage gap. I think that's very important, and you can do that by reaching out to the Alliance for Healthy Kansas. Please advance the slide. And then this is contact information for our organization. I really want to leave you with the idea that contacting your policymaker is not intimidating. It shouldn't be intimidating. They are just people like you from your community. Their role is to serve the interests of their constituents and their district. And this is an issue that has the potential to benefit every single district across the state. So I'm going to stop and answer questions as you might have them, but I also just want you to know that we have a lot of resources on expandcancare.com, and we are always willing to visit with you and help you along your own advocacy journey.
Thank you, April. My colleague at Women for Kansas, Ty Edwards, has been looking at all of the questions, and we've got a lot of them. So Ty, I'll let you take over at this point.
Awesome. Thank you so much, Susan. And April, thank you so much for sharing all of that wonderful information with us and letting us know that it's available on your website. So I will say one thing that came up in the chat a lot is how to find out the members of the healthcare committees, as that was mentioned, someone to talk to. So I just want to let everybody know, April did say go to the legislature's website, If you don't know where that is, it's kslegislature.org. So they don't spell out the word Kansas. Okay. So it's just legislature, TURE, right? .org. And if you look on there at the very top, they have the list of committees. It's one of the menu bars at the top, and you can click on that. You can also find the contact information for your own legislator on that same website if you're looking for it. Okay, so April, let's get to some of the great questions we've got from lots of folks who've been writing in. One of the things is some people have talked about how they've contacted in the past, right? Like they've contacted their legislature or their legislative representative before. One of the things people asked is, what should I say when I contact them specifically? And how do I insist perhaps in a new way?
Well, I would say whether you have had a bad experience or a good experience in the past when you have reached out to your legislator, I think that they have heard you and you have either put them on notice or at the very least maybe been a little bit of a thorn in their side, making it harder for them to use their internal narrative as evidence that people agree. So good for you for making that contact. Keep doing it and don't be discouraged. I think one of the things that you can say this year is that we now are looking at that much more urgency. We have a lot of people, because of the end of the pandemic, there is a lot of people who have lost their coverage from Medicaid. And so we have even more people in our communities who are really scrambling to try and get that access to affordable healthcare that Medicaid would provide. And in Kansas, unlike all of our neighboring states, we don't have the solution of going into Medicaid under expansion. So I think that that's maybe one point of entry that people could use to talk to their legislator this year. And then I think it's also important to say, listen, 40 states have now moved forward with this. All of our neighbors have done it. What are we waiting for? Because I assure you that the conversations are happening in the Deep South, which is the remaining block of states that are holding out. And we're going to see more states adopt expansion in the upcoming year, probably. I would say there's a very good possibility. So are we trying to be the last state? And if so, what is the purpose of that? How does that help individual Kansans and Kansas providers? And also, you know, if we're trying to make a point and say, okay, Kansas is where we're going to draw the line. Why are we hurting ourselves and turning away that financial prosperity and the health that that brings when we're already paying our tax dollars to help people in Oklahoma and Missouri and Nebraska and Colorado, and by the way, New York and California? Does that make any sense? I think Kansans are pretty practical, and it doesn't make a lot of sense the way that we're doing it.
Awesome. Thank you. So you've kind of said this, especially with this last answer you just gave us, but if someone were contacting, or maybe in your own experience, because you've spoken about this so much, what do you find people, especially maybe people who are resistant or a little hesitant or maybe outright opposed, what do you think is often most convincing for them?
I have spoken with several really conservative policymakers who believe in small government as kind of their starting point. And so we've had conversations where, they say that it's really important to them to keep government small. And then we talk about it a little bit more and they realize exactly what I said, that we're already paying for this in Kansas. This is already happening. It's just not happening to benefit any of our systems or individuals. And generally they will say, yeah, I think we need to move ahead. Sometimes I get the most positive response from the argument that we have not allowed the democratic process to work and that we haven't had a hearing on this, since 2017 and 2020. I think a lot of legislators are really appalled by that. Even if they don't particularly support expansion, they think that we should be able to talk about it in a committee in the legislature or on the floor of the House or Senate. So that's another way, I think, to say, listen, even if you don't support this, can you help us get a hearing? And many legislators are on board for that.
So one of the things that comes up in the questions a lot too relates to what you just said is about the role of House leadership and Senate leadership in preventing having hearings like you're talking about. So I did want to remind everybody that also if you go to kslegislature.org, remember I told you at the top they have the committees as one of the menus. They also have legislators, and right under that, the first link is leadership. So you can see who the leaders are for both the House and the Senate there. And would you recommend, April, contacting leadership in both the Senate and the House in all contexts?
I think that for all of us, our greatest power is with our own elected official. So I think first and foremost, we should be reaching out to them. And I think that we should be saying, listen, I need more than just your support of this issue. I need your help to get it to the floor. I need your help to get it to a committee hearing. And so, each individual legislator gets to vote for their leadership. And I think that we need to really try to get people to remember that leaders are elected as well and have constituents that they need to respond to. So yes, I think that I would say that it's important to contact your people, and you can also contact the leadership as well.
Awesome. Okay, well, I think we have time for one more. And before I get to the last one, I do want to say several people have asked in the Q&A if they could get access to the slides. I do believe we plan on sending those out. You might get multiple emails from us, one with some of the text, and then we'll send the slides out separately as well. I should also say a lot of this information, as April talked about, is at expandcancare.com, which is Alliance for a Healthy Kansas. But I want to ask you, especially as we start a new year and we're sort of all having this like new year feeling here in Kansas. April, I know you've been working on this for years. I've gotten to see you do a lot of your work across the state in many contexts. Governor Kelly talked to us about how long this has taken and some of the toll that it's taken on our state. So how do you remain hopeful in doing this work, and how do you recommend we as Kansans remain hopeful and engaged as we go through this process?
I have a couple of different ways to answer that, so I'll try and be as quick as possible. I think the first is that we get to meet a lot of the people across the state who are impacted in the coverage gap. They're living that every day. They're scrambling. In many cases, people are not able to get the access to the care that they need. People are actually dying in Kansas because we don't have expansion. So that keeps me really determined. Every time I think of them and see their faces, and you can read more about individuals who are impacted on our website under the Story Bank tab. So that's one thing. But I also think, we have long since passed the point of critical mass on this issue. There were times when I first started working on this, there was some idea that maybe the federal government would change their mind and this would no longer be the law of the land. That is not going to happen with 40 states already on board. So I know that this is going to happen in Kansas eventually. And my drive is to make sure it happens before more people die, before more hospitals go under, before more people have to suffer, just out of what seems like an arbitrary, almost stubbornness for us to move forward. So I think that those things, a sense of wanting to see justice happen and wanting to see Kansas move along with the rest of the country so that we can work on other important issues in healthcare and stop working on something that should have been a no-brainer almost 10 years ago when we could have first done it in 2014.
Yeah, absolutely. Well, thank you so much, April. And I want to remind everyone, expandcancare.com. You can also learn more about Women for Kansas at womenforkansas.org. I know we're all on all the socials as well if you want to use any of those platforms to find us. And again, we will send out more information after this. Susan, do you have any parting thoughts?
Yes, I do. This has been a wonderful webinar. I want to thank you, April. Again, thank the governor. Let me reiterate that this is the year for Medicaid expansion in Kansas. We cannot wait any longer. You've heard the action steps. We can do it as individuals and we can do it as a group. We can do it through multiple phone calls, visits, emails, letters, postcards to keep up the good fight and to inundate our legislators and our leadership to bring it to the floor, to have the hearing, and to pass Medicaid expansion. I want to leave you with a visual. The visual is the Miracle on 34th Street at the end, where you have the judge trying to decide if the Macy's Santa Claus is the real Santa Claus. He is inundated with letters from the post office. Think about that visual. That's what we need to do. If we inundate our legislators, they will have to pay attention. The pressure, keep the pressure on. This webinar will be available on our YouTube channel, and our website, our Twitter, and if you register, you'll get a weekly email from us. Thank you so much, everyone. This has been wonderful. Let's go expand Medicaid now.
Thank you.